Hello, my name is Jill Bray-Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'm joined again by Dr. Gregory Brophey, and we're going to be talking about an eye condition called dry eye. So it's an important one for everybody to pay attention because you may not even know that you have this. So we're grateful that you're back.
Thanks, Jill. It's good to be back.
Yeah, you come back and you talk about these eye conditions. They're really fascinating. So glad to have you here. But just in case someone hasn't seen you on our show, if you could introduce yourself, and then we'll jump into the subject of dry eyes.
Sure. Well, it's great to be here. I'm Greg Brophey. I'm a board-certified ophthalmologist, and I've been on Northwestern Medical Center's medical staff since 2008, and originally from Ohio. So I moved here from Ohio in 2008.
Great. And we've been so lucky to have you.
Oh, thank you.
So let's talk, what is dry eye? Let's just start there, and what are the symptoms?
Well, it's a very, very common condition, and one which I think a lot of patients right out of the box are not really that familiar with. To be very basic about it, dry eye is a condition in which the eye cannot maintain its own lubrication. Your eyes need to be constantly bathed with a tear film. Blinking distributes those tears over the surface of the eye, and over time, for a variety of different reasons, we can produce less tears. There's a lot of different reasons why. But when patients stop producing as much tears as they do, they start developing a lot of symptoms such as burning, light sensitivity, and pain. And dry eye syndrome in its severest stages is really a form of a chronic pain syndrome because a lot of the there's a lot of upregulation of the nerves in the eye, and that can cause a very, very painful condition. So patients come in off the street typically complaining of some of those symptoms.
Yeah, I was going to, how does it affect the patient? What do they first start complaining about?
Well, typically patients don't come in off the street complaining of dry eye. They come in complaining of some of those problems. My eyes are red, they're tearing, they're burning.
Okay.
I can't see on the computer for long periods of time. And that can affect really a lot of other aspects as well. Some patients can become very, very light sensitive. They'll say that they're needing to wear their sunglasses even indoors, or they have to avoid large windows at home. And it can affect every aspect of their work, their at-home life, their play, just everything. So it can be pretty all-encompassing in terms of symptoms.
And what causes this fundamentally?
Well, it's multifaceted, and that's one of the hardest things that is a challenge for us as ophthalmologists for treatment. One of the common causes is aging. Hormonal changes and menopause is a very common cause of it. Other things are excessive use of computers, people that are at work for a long period of time. And
I think I'm doomed, Jeremy.
Don't worry, there's help for you. Don't worry, I got you covered. There's exposure to air conditioning, circulating air in buildings. If you have a poor quality of air in the workplace, sometimes air filtration can be helpful. Exposure to smoke, and then medications that people can take are also a very, very common cause. And we can't always control that, but medications such as antihistamines, people that have allergies, people that are on certain antihypertensives like diuretic medications, acne medications, birth control pills, antidepressants, and so the list is rather long.
Wow.
And if you look at your list of side effects on the medications that you might take, you might see dry eye or eye conditions as one of the side effects.
Wow. There's a lot that play into this.
Yeah, certainly. And that's what contributes to the challenge in treatment.
Yeah. And why we're so important to talk about this, because people may not know the itchiness and all this stuff, what it is, and that's fascinating. So what are the common treatments? The
most common treatments are artificial tears, and these are available over the counter without a prescription. If you go into the grocery store wherever you shop, let's say it's Hannaford's, and you are looking at the eye care section, you're looking at the artificial tears, there's going to be a large selection of artificial tears to choose from. Some of them are good, some are not. Typically, I tell patients to stay away from generic medications. Those are not as good as the name brand medications.
Okay.
Eye drops are also available in bottles or in little dropperette vials. Generally speaking, the smaller quantities that you buy, the least preservatives that are in those those drops. Initially, artificial tears and some of the generic ones still are preserved with benzalkonium chloride, which is toxic to the ocular surface. So if you're putting those in, you're not really helping, you're making the symptoms a lot worse. So typically getting the smaller bottles and the vials of artificial tears are best. And you want to look for something that says for dry eye relief. You want to stay away from things that say redness reduction and itchiness relief, because that's not what's going to treat your dry eye. Really what you want to do is replace with a solution that is very similar to the chemistry of the tears that your body makes on its own. Some common name brands would be Sustain, Refresh, Genteel, TheraTears, Soothe. Those are all very good. Artificial tears also come in different consistencies. There's a very, very thin liquid tear, which is for patients with mild dry eye. And typically I tell patients if you're using tears several times a day, the liquid tears are just fine. Some patients, when they put in tears, they don't feel that they have a long-lasting effect. So within 10 or 15 minutes, if they're feeling dry again and they're having to put in another teardrop, the next product up would be a liquid gel. So these have a thicker consistency. They have a side effect of blurring the vision. So when patients put those drops in, they may not want to get behind a car or start using a computer right away. You may want to give it a couple of minutes. But I have dry eye and I use the liquid gel drops, and I only need 1 or 2 drops of those per day. And I just wait 5, 6, 7, 8 minutes, and then the vision is back to normal after putting them in. So those can be an effective strategy at better replacement therapies that don't require so many teardrops during the day. And then finally, there are ointments or gels that you can put in your eye, typically at night, because if you put them in during the day, you won't see anything for a long time. And those are helpful for people that wake up with problems such as burning, excessive blurriness, and if it feels like they're taking a long time to kind of get their eyes going first thing in the morning, a lubricant ointment would be very helpful to put in before they go to bed at night. So those are some of the most common ones, and those are all available over the counter without a prescription. But the big things are to avoid the generic medications and anything that says redness reliever on it.
Great. That is fantastic advice. Does anyone ever get to the point they need a prescription, or is there even prescriptions out there? There
are several of them. The first one came out in 2003. It's called Restasis, and a lot of people are very familiar with Restasis because of the marketing and the advertisements that are on TV. The next one that came out was Xiidra. It was 13 years between Restasis and Xiidra. Xiidra came out in 2016. Both of those medications are very effective at helping to decrease the inflammatory component of dry eye, because we think that's just as important as the lack of tear production is with dry eye pathophysiology. So they're very good at down-regulating inflammation and also can help increase the patient's baseline tear production. Those don't start working right away. So typically when patients come in and they're unhappy with the improvement that they're getting from artificial tears, they'll ask about some of these prescription medications. Typically those take a month or two for patients to start to see an improvement. I tell patients when you start the medication, it's going to start working right away, but they may not start to see an improvement in that right away. Typically, the first thing that patients will see when they're starting artificial tears or prescription strength medication is an improvement of their vision. And then after that, they might start to feel some improvement in the comfort of their eyes, less of a feeling of dryness. But the prescription medications are costly. Some patients, the medications are not covered by their insurance, so it's something that we have to kind of do a trial and error and see if their insurance will cover it. And if patients have failed one or more different types of artificial tears, sometimes our staff can work on a prior authorization for that patient so that their insurance we can make an argument to their insurance company to see if they'll cover it. But the cash price of it is in the thousands of dollars for a 6-month course of therapy. And those medications can burn as well. So typically if someone comes to me with a really red or inflamed eye, I'll put them on a really short course of topical steroid drops. So that's another relatively inexpensive medication that we can use to help reduce the inflammatory component of dry eye. We tend to not like to treat patients long-term with topical steroids because it can have side effects. It can cause a patient to develop cataract, or it can cause eye pressure problems. But it's useful in the short term as a means to bridge that gap as we're starting one of the other prescriptive eye drops.
So thank you for that. So I think about my mom, and she may not be able to get those eye drops in. Is there other types of treatments that are not by putting something in your eye? Maybe not.
That's a great question. I have that very same concern with a lot of my elderly patients who either have arthritis and they can't squeeze the bottles or the droppers, or they're getting more tears on their cheeks than they are in the eyes, and it's expensive. And patients tell me, I go through a bottle of this a day and I don't feel like it even gets in the eye. So yes, there are other things that you can do. One of the easiest things to do, and this is a helpful adjunct even if you're able to use artificial tears, would be to do a warm compress. That's a simple thing to do. You just take a washcloth and dip it under warm water, wring it out gently, and hold that over your closed eyes for a couple of minutes every night. What that does is that opens up the oil glands in the lid, and if you can follow the warm compress with a little bit of massage where you can kind of press your finger directly in on the eyelid, you're squeezing the oils from the lid out onto the surface of the eye. On the surface of the eye, you kind of have your tear film, but that's a multi-layered structure. The tears make up the middle layer. Against the eye, there's a mucin layer, so like a mucus layer. So you have the mucus, the tears, and on the top, you have a very thin oil layer. So some people that have dry eye, they produce enough of their own tears, but they have evaporative tear loss. So attention paid to the eyelid, a moist, warm compress is very comforting, and it also helps to stabilize the underlying tear film. The other thing patients can do, and this is something that they typically don't think about, is to modify their environment. If they're sitting next to the air conditioner at work, they need to move. If it's a very dusty environment, air purifiers can help. If they're on an offending medication, try to go on to something else. So when I'm counseling patients about their medications and they're anxious to stop something, we really have to involve the patient's primary care physician in that discussion, because stopping, for instance, a medication for high blood pressure to fix dry eye is not a good solution. So those are some of the kind of non-eye drop treatments that are very common. A couple of other things that we can do surgically in the office. We can do a procedure called punctal plugs. These are not great options for patients that have inflammatory dry eye, but for people who aren't producing enough tears, these are essentially they're like little tiny golf tees, and they fit in they're very small. They fit in the puncta, which
I was going to say the visual of this, yeah.
Yeah, exactly. They fit in the punctum, which is the tear duct in the lower eyelid, and that helps to prevent tears from being absorbed into the tear duct. And those are placed at the microscope using very fine instrumentation. So we can do punctal plugs, and those are removable as well, and it doesn't hurt to do this. Some patients that have problems closing their eyes, or they have a very slow blink or an incomplete blink, patients with Bell's palsy who don't close their eyes all the way, they can have surgery to kind of partially close the outer parts of the lid. So the upper and lower eyelids are attached together using sutures. That's a procedure called a tarsorrhaphy. So that can help limit the aperture, so that the distance between the upper and lower lid, we can reduce that so that there's less surface area for tear evaporation. So that's another thing that can be done in severe cases of dry eye, in which the patient's cornea is very sick from not getting good lubrication.
Wow. So what about if you wanted to wear contact lenses or have the LASIK surgery? Does dry eyes interfere with those?
A lot of patients come to me and they're interested in wearing contact lenses to help reduce their glasses dependence. And if you have dry eye, putting a foreign body on the surface of your eye contact lens can be very problematic. So we have to take that patient by patient, and sometimes those patients need to have their dry eye optimized before going into a contact lens. Likewise, some patients come to me because they can't wear their contacts. Their eyes are too red, they're uncomfortable with the contacts, their vision is not clear. Perhaps if they've got an astigmatism correcting contact lens, a dry eye patient, that contact lens will not rotate appropriately on the surface of the eye, and therefore it'll cause blurry vision. So I really have to caution those patients about LASIK surgery, because LASIK surgery can injure corneal nerves, and in patients with dry eye, those nerves are already kind of being overstimulated, so LASIK can further exacerbate that. So I'm not going to say no to that. I think it really depends on the patient, and that has to be completely individualized.
Would that be the same with cataracts as well? Or?
Totally. Anytime we are doing surgery on the eye, we're manipulating the eye and causing any sort of surgical trauma to the eye, that is something that can aggravate underlying dry eye. Likewise, when patients come to me for cataract surgery and they complain of blurry vision, part of their blurry vision may be due to the cataract, but part may be due to dry eye. So as clinicians, we have to be very astute at trying to pick up those patients, because if we do cataract surgery on a patient and we don't properly identify or treat dry eye first, that patient's going to have problems with their vision, pain, and a lot of light sensitivity after cataract surgery. And so it's kind of like digging yourself out of a hole at that point as a patient. So we really have to optimize and look for it very carefully as part of our overall evaluation when we're doing cataract consult for a patient.
Wow. We've learned so a lot. At least I've learned a lot in this session. And wow. So we're coming to a close, Dr. Brophey. Is there anything else that we should know, or how do folks access you if they start having these symptoms and they want to talk to you about it, or talk to you about it, maybe a primary care doctor about it? So what's the next steps if they're hearing this and they're saying, I think I have this. What do you want to tell our viewers?
Well, certainly they can call for an appointment. I'm happy to take a look. It's a very common reason for a referral to my office for patients that have these concerns with visual discomfort, strain. They can't get through their day because they're uncomfortable. They can't wear their contacts, that type of thing. So that's a really common reason for a visit. And so if patients are wondering or they're just curious, they're always welcome to make an appointment with my office. And it's, again, because there are so many different causes and so many different aspects to the pathophysiology of dry eye, it's a really, really tough thing to treat. And I tell people this is a chronic condition, kind of like diabetes or blood pressure. It's not typically something that goes away. You can have waxing and waning of your symptoms over time. Some people do go months at a time and they're fine, and then come back in with extreme exacerbations of their dry eye. And there's a lot of interest. There's a lot of research being directed towards new medications for dry eye. There are even things like, I've read reports of acupuncture being helpful for patients that have severe dry eye, especially as it relates to the pain aspect of dry eye control. So interesting things on the horizon for us, but again, it's a challenging disease, and one that I don't think we're going to have a cure for.
Oh, thank you. Thanks for being here. I can't wait to our next topic. I learned so much from you. So thank you,
Jill.
and how important
Thanks.
the eyes are. Wow.
Agreed.
So thank you all for joining us today. I'm Jill Berry-Bowen, CEO of Northwestern Medical Center. So grateful to have Dr. Brophey here to talk about dry eyes, because I'm sure there's many of you thinking about, wait a minute, I may have that, and I'm seeing symptoms that we've outlined. So give us a call. Reach out to Dr. Brophey or your primary care provider so that we can help you. So thank you for joining us today.